Hello, I'm Dr. Smita Nagpal, a dermatologist and a cosmetic dermatologist, and I have two clinics with the name of Anya Skin Clinic in Ahmedabad. Today, on behalf of DermaVidya, I'm here to talk about hair fall and in females and what are the remedies. I think all the females will agree to me they're facing hair fall sometime or the other in their lives, and it's very difficult to really find out the cause. The common causes that could be, see, I generally tell my patients the hair fall is more internal, so it will depend on your nutrition. So it depends on the vitamins, it depends on the proteins, it depends on your iron levels. So anytime your body is deficient in B12, D3, you're anemic, your iron levels are low, your zinc levels are low, you can have a lot of breakage of your hair and hair fall. Protein plays a very important part, and if your diet is deficient in protein or your body has protein deficiency, that is again a very common cause of hair fall. The other common causes of hair fall are any kind of medical illnesses that you have, like thyroid is a very common cause for hair fall. If you've gone through any some illness like in between we had COVID, if you had dengue, you had chikungunya, any kind of illness on the body, you can have hair fall after a few months of recovery. Any surgery that you've gone through, you could face some hair fall after that. If you're on certain medications, we need to look out for that. And very importantly, stress is one of the very common causes of hair fall. So after we evaluate you, sometimes we also get your blood test done to see, if you're missing any internal causes of your hair fall. We thoroughly investigate and find out the cause, and then we can treat your hair fall accordingly. Usually a dermatologist will give you a good supplement for your hair, which contains a lot of multivitamins, it contains biotin, it contains iron. You should improve your diet, and with a holistic approach like this, with your help of a dermatologist, you can get your hair fall under control. While we are taking the history of our patients, when a patient walks in with hair fall, I think the commonest history that we should start with is to ask them about their dietary history, about what kind of a diet they have. We should always rule out if they have any anemia, if they have a menstrual history is very important to see if these females are having any kind of blood loss that is happening. We can always ask them for any past history of any illnesses, any medical illness or any surgery that they've gone through in the last few months, because all of this will give us an idea about the exact cause or the etiology of hair loss in these patients. These patients generally require a good workup to rule out, to see what is their hemoglobin, to see their B12 levels, their D3 levels. I always get a ferritin checked to see if they have any kind of total iron in their body, the storage, how much it's happening. And I also get a thyroid profile done, because as we all know, thyroid is one of the commonest reasons for hair fall in these patients. So after you've taken a thorough history of the patient to rule out any medical or surgical illness, or you come down to the exact etiology and you've investigated your patients, the remedies basically revolve around that. Good hair supplements can be prescribed to these patients. I always try to supplement them with iron. We give them B12 supplements, we give them D3 supplements, and along with that certain kinds of solutions can be prescribed, like either a peptide based or a minoxidil base, depending on whether it's a diffuse hair loss or a telogen effluvium or a female pattern hair loss. So a holistic approach like this can help our patients, or the female patients with hair loss.
For more such videos, visit or log into dermavidya.com.